Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, this is the wrong bill at the wrong time. To introduce a bill like this when the COVID pandemic is far from over and staff are on their knees shows a lack of understanding of what's needed. I'm also concerned that this reorganisation of the NHS is being used as an opportunity to extend the involvement of UK and international private healthcare companies. The bill is proposing that private healthcare companies can become members of integrated care boards, potentially procuring health services from their own companies. Under the bill, these ICBs will only have a core responsibility for a group of people in accordance with enrolment rules made by NHS England. There are concerns that this evokes the US definition of a health maintenance organisation, which provides basic and supplemental health services to members. So can I ask, what is included in these core responsibilities? Why is there no longer a duty, only a power for ICBs to provide hospital services? What does this mean for the thousands waiting for elective surgery? What about those waiting for cancer and other therapies? For those saying, what does it matter who provides our healthcare as long as it meets the NHS principles of being universal, comprehensive and free at the point of need? Well, firstly, the bill is a clear risk to these founding NHS principles. But there's also strong evidence that equity in access to healthcare, equity in health outcomes, and healthcare quality are all compromised in health systems that are either privatised or marketised, as the NHS has increasingly become. This brings me to my third area of concern, health inequalities. It was noticeable that the bill places the duties for reducing health inequalities with ICBs. The 2012 duty on the Health Secretary in NHS England to reduce inequalities has been repealed, showing the clear lack of commitment to levelling up, to reducing the structural inequalities that have been laid bare by this pandemic and that have contributed to the UK's high and unequal COVID death toll. By doing this, the Health Secretary is not only ignoring decades of overwhelming evidence that clearly shows health inequalities are driven at national policy level, but is ignoring the commitment that the Prime Minister gave to implement Professor Sir Michael Marmot's recommendation from his COVID review last December to tackle these inequalities and build back fairer. My fourth and final point is on social care. As chair of the APPG on dementia, I want to express my profound disappointment that 19 months on, the Prime Minister's pledge to fix the broken care system is still not done. The bill is a missed opportunity for setting out the framework for social care reform in the context of an integrated health and social care system. For people with dementia and their family carers who've suffered disproportionately from COVID, this is a real blow.